A 22-year-old woman comes to the clinic because of fatigue for the past 3 months. Compared to her last visit, she has lost 15 pounds, 6.8 kilograms of weight. She appears anxious and is sitting with her arms folded. Her pulse is 95 per minute, respirations are 16 per minute, and blood pressure is 125 over 75 millimeters mercury. Which of the following statements by the physician would be most helpful in eliciting this patient's history? Choice A, have you been trying to lose weight? Choice B, have you been feeling depressed recently? Choice C, when did you start losing weight? Choice D, can you tell me more about your recent diet? Choice E, have you been sleeping well? I'll wait 5 seconds and answer the question. So as usual with ethics questions, you want to ask open-ended and empathetic questions. So the only answer choice here that makes sense is choice D. Can you tell me more about your recent diet? Sometimes these ethics questions can be kind of annoying because a lot of the other answer choices might seem like they could make sense, and they're not necessarily bad answers, but the way you spot them is that you look at them and they will either force the patient interview into an overly restrictive answer from the patient, or it makes assumptions that you really shouldn't be making. So let's take a look real quick. Choice A, this is a closed-ended question. Have you been trying to lose weight? I mean, that's a yes-no question. That's not going to be very helpful. And beyond that, it just sounds a little bit judgmental. We don't exactly know why this patient is losing weight. So yes, some of you might have picked something like this with the assumption, well, I want to know more about why she's losing weight. Obviously with your most severe concern being a malignancy or something, but if she has depression, or she has an eating disorder, or she just has anxiety about her appearance, you obviously don't want to set off the assumption that you're being judgmental about her appearance or any behavior she might have. So similarly, choice B, have you been feeling depressed recently? Again, that's a yes-no question which can force the interview into too narrow of a position, and you really have no reason to suspect depression yet. So you don't want to force that into an implicit assumption in your question. Choice C, when did you start losing weight? This can actually be a helpful question to ask, but only later on in an interview. They do like giving answer choices like this sometimes, where it's just like, it sounds reasonable as a question, but you need to consider first that you need to ask a broad question. And finally, choice E, have you been sleeping well? Again, this is too closed-ended. You can answer this with yes or no, and you are unnecessarily narrowing the differential here. I mean, if you focus completely on her sleeping in regards to her fatigue, you might be thinking about depression or hypothyroidism or something like that. Again, you don't want to unnecessarily focus the interview towards something when you don't have a strong suspicion one way or the other yet. I would say this question is relatively easy, but this is just to say that as a general rule on MBMEs and USMLE, just pick the most open-ended question out of all of them and you'll usually get it right. Yes, it's a little silly, but this is just how they write their questions a lot of the time. I hope you found this video helpful. I'll see you in the next one.